I'm going to welcome Mr. Katunzi Imperius Mtalemwa. Can you hear me? Mr. Katunzi, are you? Okay.
Yes.
All right, Mr. Katunzi Imperius Mtalemwa, he's RN currently part-time teacher at Tosamaganga Nursing School. Also works as an assistant project manager of NDC's project with an organization of Doctors of African CUM, trustee in Iringa, Tanzania. Graduated with bachelor degree in nursing from KCMC in Tanzania. Author in multiple nursing books. One is Nurses' Experience for Caring for LGBTQ patients with HIV infection at Swedish Red Cross University in Sweden. And another book is Nurses, Cornerstone of Healthcare System, former chairperson of University of Nursing Student Association of Tanzania, UNISATA. Background includes organization, various community activities, and now a new QHC member. Now welcome, Mr. Katunzi.
Okay, thank you so much. I'm glad to be here with you this moment. I would like to add something with regard to professionalism. Actually, I should commend Dr. Mlawa for what he has said regarding to professional. By starting, I should say that nursing professionalism now is a debatable thing, especially here in Tanzania, since we have been hearing a lot of misconducts and some of the things that are going wrong. Sometimes many things have been done because people, they don't really know, and sometimes because of the carelessness. So I would like to share something in general about the self-confidence and the support to each other and the unity among nurses. And then I will start by the scenario. I think it was like last 2 weeks ago, I just heard that there were maternal deaths that happened in one hospital. I don't want to mention it. And there were like a couple of nurses who were working, and then there were like 4. And the one nurse who conducted delivered that mother, soon after delivering, she jumped to assist another mother. And she just left that mother for some time, of which another nurse came to take a position. And unfortunately, that nurse who take a position, because the ward was very busy on that day, didn't remember to take the vital sign soon after delivery of that mother. And they just took mother to the post nat ward. And after some times, the mother started to have the PPH. And at the end, she died. And the nurse who was watching, who was assisting them, I mean, those who were doing deliveries, she just saw that nurse that she forgot to perform, to take the vital sign, and she didn't say anything. And soon after that misfortune really happened, she just came out and tried to say that the reason behind it is like this nurse didn't take the vital sign, so she could know the status of that mother soon after delivery. And then I was asking myself why this is happening, because if somebody is well entitled and having the good professional heart, for sure, she could tell them what to do soon after delivery, and then something did happen wrong, and then people were accountable. So you can just simply say, see that some of people, some of the working colleagues, they don't have the unit, and sometimes the self-confidence to shout out, to say something that somebody will have done this, but there is something missing. Maybe if you could say something like that, maybe that mother could be saved in one way or another, but just related to the problem. But also there is another problem which I can share regarding to professionalism. It is a relationship between the professionals and the society. It is, however, known that there are some of the people in the healthcare settings who are well appreciated because of their vital work they are doing. But also there are some of the people who are not well recognized because of the poor system of the poor relationship they have with society. By giving the example, there is one day, I think I was in one of the big hospitals here in Tanzania. It was morning, one of the regional commissioner once go to visit the patient. I think he was a relative. And they just found one nurse who was making, I don't know, here in Tanzania, there is something what we call the carburization. I don't know. We clean the intestines, everything. And when she just entered into the ward, that nurse shouted at her, and then she didn't know if that was the regional commissioner. And unfortunately, there is one nurse who came back, and then she was about to tell her that please don't shout because this is the regional commissioner. And then the regional commissioner make a sign to that nurse, please don't tell her, because when you tell her, she will try to change, or she might end up with something like intention. So at the end of the day, that nurse said a lot of words which was not good. And then when she came to realize that somebody whom she was working with was the regional commissioner, it just she just felt well, and she didn't feel good at all. And this I would like to say that this is the kind of relationship we should at some time, to avoid the double standards, that when you are doing the work, especially in the healthcare settings, we should attend and try to respond to all people regardless of their status and so forth. So that nurse, she just felt bad because she had responded bad to that regional commissioner. But on my mind, I thought that maybe this is the normal routine. She were used to respond in that sense to all people whom she is giving care. And finally, by finishing, I just wanted to give one example, which is more vividly on professionalism. I have been hearing sometimes that many of people who are the healthcare professionals, may I speak something on nurses, you can find that a nurse is getting out of the society and say that I have like 4 kids, but among of my 4 kids, I don't want any one of them to become a nurse, just simply because nursing professional is undervalued or unrecognized or underpaid. So you can just simply say that a professional strategy of healthcare providers basing on nurses should start by themselves of having the self-confidence. So this is really demoralizing even the youngsters who are joining the profession. I know we are learning a lot of stuff in our schools, but when we come to the settings, we have to work with seniors. What if a young nurse come to the hospital and find there is a senior who seems to be demoralized, who seems to give some of the discouraging words? This really made these youngsters sometimes to do some of the things. I think I'm going to speak much on the competence about this, but also this as a great contribution on the great demand actually in professionalism. I can just simply say that. Thank you.
Mr. Katunzi, I have a question. So do you have anything in place right now in places that you work, or as of now, that they have specific guidance to help new nurses or new employees to an area? Like what Dr. Mlawa said, they do have certain things like an orientation, or they have the guidelines that you give a new employee how to behave, how to demonstrate professionalism at that institution. So on your experience, have you had those, I mean, in the hospital that you've worked with, do they have guidelines or training for people to know what is professionalism? Because the issue could be that people do not know what is professionalism, because sometimes we have to make sure everybody in the same page on the definition, what exactly it means to be a professional. So if people do not get that definition or workable definition at that institution, we might lose people. People may behave disrespectfully without knowing that that is beyond of what they were expected to do. So in your area, have you received those training on those hospitals? Have they provided those training?
Actually, I can say that these training, like induction course, they are, but you know, here in Tanzania we have a problem of recruiting these people. So especially the healthcare providers. So especially in the private hospitals, you find that these providers, they have been recruited at different times. It's not possible that all of the workers, they come at the same time. So you find some people, they just come today, other they come tomorrow. So to have an harmonization of training them at the same time is a little bit challenging. But what I know is like for these new young graduates, sometimes they have like 4 or 5 intervals of just giving them like an induction course, but it's not so obvious.
Okay, thank you very much. So